My name's Seth Bannon, and I'm a founding partner at a VC fund based in Silicon Valley called 50 Years. At 50 Years, we invest in technology companies at the intersection of a path to $1 billion in yearly revenue and the potential to create massive positive social or environmental impact. So seeing a trend coming before other people do is massively advantageous. It's one of the reasons why conferences like Pioneers are so valuable. But most of the trends you hear about are what trends? The cloud, mobile, AR, VR, drones, AI. These are all the whats of business. The trend I'm going to tell you about is a why of business. And it centers around this question. What is the purpose of business? If I did a poll and asked you in the audience what the purpose of business was, you'd probably say something about making money. Or put a more formal way, maximizing shareholder value. And this is how people have thought about business for the last 50 years. In fact, this idea is called the Friedman Doctrine. And it was popularized by Nobel Prize-winning economist Milton Friedman. In a 1970 op-ed in the New York Times, he argued that companies that consider anything beyond profits, companies that consider the quality of the environment or the health of society or even the welfare of its own employees, he said companies that considered those things were undermining the basis of free society. Luckily, this idea is being torn down. And in its place, brick by brick, is being built a more inspiring conception of business. An idea that the purpose of business can be both to make money, but also to improve society or protect the environment. And so there's a lot of data that I have to show that this trend is actually happening. I can't take a deep dive with you today, but I'm going to give you some highlights. This is a graph of benefit corporations founded in the United States over time. A benefit corporation is a corporate entity where you can bake social or environmental impact into the bylaws of the company. And as you can see, this is hockey stick growth. This statement, that the success of a business should be measured in terms of more than just its financial performance. 87% of millennials globally agreed with the statement. There's a study done by Deloitte of 7,700 millennials across 30 countries. And it's not just the goody two-shoes. 83% of MBA students, typically the most money-grubbing members of society, would take a 15% pay cut to work for a company that had positive social or environmental impact. And by the way, this number 9 years ago was 26%, and 5 years before that, this number was 14%. It's continuous and sustained growth. And this is the kicker. Millennials, unlike any generation in history, want to align their values with their careers, which means if you want to recruit and retain the top talent of tomorrow, you have to bake impact into your business model. And there are many other advantages. It's easier for impact companies to get press. Their customers are more loyal and more forgiving of mistakes. Employees at impact companies have been shown to identify more with the company and be more creative and more productive. The list goes on, which is why impact companies actually outperform their peers judged on purely financial basis. So at 50 Years, we believe that the most valuable companies of the next decades will be those that are solving the world's biggest problems. And I'm not talking about small problems. Forget reducing enterprise churn by 7.4%. Forget pairing people with the perfect pair of socks. And forget making sure someone can get, the second they have a craving for sushi, an order with the click of a button. I'm talking about the big problems. Solving the climate crisis, educating everyone, feeding the world, defeating disease. Business can solve these problems, and ones that aren't will have trouble competing. So people often ask, what exactly do these magical companies look like that are on the path to generate both massive profits and massive social or environmental impact? Well, luckily today, you're going to get to see an example of two of them, both 50 Years portfolio companies. The first company is called Athelis. It's two founders out of Stanford. They're backed by Sequoia, one of the leading investors in Silicon Valley. They make a small, rapid affordable, accurate blood diagnostic device. Using machine learning and computer vision, they take a prick of blood and turn it into a diagnostic. And I have one at home, it works, and today they're going to show you their technology. So Tanay, please come on out. Please give a round of applause for Tanay.
Thank you. Thank you so much, Seth, and thank you so much to the whole conference for having us here and just giving us the opportunity to show you guys what we've been working on for the last couple months. Like Seth mentioned, we're big believers in the fact that it's possible to extract immense value as a business while at the same time doing inherent social good. And this is our spin and take on that concept that Seth was just talking about. So specifically, what Athelis is a portable blood diagnostic device. And we generate a count known as the CBC, or the complete blood count. Some of you might be familiar with it, but it's the most frequently ordered blood test in the world, and has a $50 billion market cap, or ordering volume every year. And it can tell everything from something like an infection, all the way to leukemia, allergic reactions, asthmatic reactions. It's a very important benchmarking test. And yet, for years and years, it's been only present in one or two forms. One, either as a microscopy, where a pathologist sits in a lab and physically analyzes a blood sample, or two, as a flow cytometry, where large volumes of blood have to pass through a $100,000 or $200,000 machine in a lab run by a technician in order to generate highly accurate values of what kinds of cells are present. Now, our solution to this problem is to apply computer vision. We take a drop of blood, much like a microscopist or a pathologist would look at it in a lab, but instead of having someone visually analyze it, we've trained deep learning algorithms and convolutional neural networks to look at the cells, their features, and their morphologies in order to generate what's effectively a CBC, or a complete blood count, in a fraction of the time for a fraction of the cost. So with that, I'm sure all of you are thinking of another company that claimed to do similar things, but I'm here to convince you that we're a little different. So the first step that we took when we were developing this technology out was first, obviously, we prototyped it, validated it in tons of bench trials, both at Stanford and in our own garage laboratory. And then after that, we worked with a hospital known as FEMAP, where we ran a large clinical trial across 350 patients, where we took venous samples and then ran them through the traditional mechanism known as Coulter counting or flow cytometry. And then we took a drop sample and ran it through our device. And inherently through that, through this sort of clinic that we set up, this trial that we set up, we actually identified a case of leukemia that went unnoticed by doctors while they were, seeing the patient themselves. In fact, this patient wouldn't have been detected had it not been for the fact that our system was set up over there and we were ready to take drop samples. So a little bit about our accuracies. What we sort of we're a 510K class 2 product as was classified by the FDA. And what we inherently have to show is high adherence to false positive and false negatives, and more importantly, good linearity in association with the venous counter. And that's exactly what we're sort of highlighting over here in this graph. We're across 5 clinical ranges that the Beckman counter is evaluated on and white blood cell counts are evaluated on. We had 100% clinical range accuracy, which means we correctly predicted what the count would be from the drop sample every one of those times across all 350 samples. So this isn't just something that's, in a lab or in theory. Immediately after we completed this trial, we started putting this stuff into production. We started submitting the necessary documentation, design controls, data to the FDA. And following that, we started essentially amassing a small but very dedicated group of consumers and customers. Those include some hospitals, research groups, companies that we're ideally looking forward to partnering with in the future and have ongoing relationships with, like the Leukemia and Lymphoma Society, to bring the device to all of their patients. And most importantly, we have an internal manufacturing chain that can produce 1,000 of our test strips a week, and tons of devices as well. And the device is incredibly cheap, only $250. So a little bit about our technology. We always love going over this and sort of explaining what the nitty-gritty is, what exactly is going on. So we take a drop sample, we put it on our strip, and then from there, using microfluidics, the strip generates a monolayer of blood. A few minutes later, that monolayer is inserted inside the device, and we have conv-nets that are trained to analyze the various morphologies of those cells. So in the image over here that you can see above, we have a white blood cell with a specific morphology that's classified and extracted out, and then counted as part of the classifier. And our overall training procedure is we have a fleet of devices, and essentially, samples are run every day, and we're collecting these images on the back end, and on the scale of 10 to 20,000 images, cellular features per day. And we're able to retrain on those features, making the algorithms inherently smarter, maybe eventually learning to diagnose more diseases. And that's all working on the back end of NVIDIA K80s on AWS, and then renders very simply on our mobile app. A little bit about our team. We're really honored to be working with a group of amazing people, specifically Dhruv, who was at Udacity before and led up a lot of their machine learning efforts. Steve, who was at Modbot and has extensive experience in the robotics industry. And then Deepika and I have backgrounds that are in computer vision, ML for me, and then Deepika has worked at the multimodality imaging lab at Stanford for many, many years. Our investors, like Seth mentioned, we're incredibly excited to have them as partners and them as believers in the mission. Seth actually received the first production unit of the device and ran the first test out of the US. He was in Europe when he ran the test. And other than that, we're honored to have Sequoia Capital as backers, Y Combinator, we were part of Summer 16, and then a group of advisors from the AI and medical field. So overall, that's really what I think our core proposition is. We're a company that's enabling, rapid diagnostics. Take one drop, 2 minutes, and you get a very preventative sort of explanation of a white blood cell count and eventually other cell counts that can identify tons of diseases. Just a quick insight into some of the things that are coming forward and that we're really excited about. The first real core application is with chemotherapy patients or people who are inherently immunodeficient. And using the device, they're able to monitor when their counts drop too low or they're neutropenic during chemo, and they can sort of ease off the chemo or use immune-boosting supplements. Similarly, in scenarios with leukemia, where you have mass proliferation of white blood cells, you can actually see that the trends where the cells may begin returning back to higher levels and make the chemo more aggressive. Or identify conditions like a relapse. And we really want to be a comprehensive immune monitoring platform where we synthesize symptomatic data, cellular data from our system, and data from doctors, and then put this in one place that can then be used for smarter diagnostics that just weren't possible a few years ago. And finally, something that we're really excited about and just beginning to share with people is our study on predicting sudden cardiac arrest. And I think this is something that we're going to see more and more of, where the ability to extract more signal from a single drop of blood and other bodily fluids is going to enable us to see things that previously weren't visible. For example, post a heart attack, in a lot of cases, there'll be inflammatory spikes that can be signifiers of high risk for an SCA event, or a sudden cardiac arrest event, which is actually the event that causes 95% of the mortality in association with cardiac events. And by predicting that event 3 or 4 days early, when we see the spike in the inflammatory markers, specifically the white counts using our device, we may be actually able to prevent the heart attack itself. So that's Thelus. You can shoot me an email at ttandon@stanford.edu. We're aggressively hiring right now, and we're really looking forward to hearing from the research community, the startup community, and just anyone else who might be able to really help us out. And with that, we have a special guest. I'd like to introduce Daniel, who's going to be, hopefully we're going to have a demo set up for you guys to run a quick test on the device. And I really look forward to showing you everything working.
Thank you. Hello, mate.
So what we're going to do is...
Hi.
Daniel?
So, talk us through it. Hello, pioneers. Are you well? 3 people? 5 people? 6? I'm about to give blood for you people.
So we have an
Oh my goodness.
They'll wake up soon enough. So we have an Athelas test strip over here. It's just a package where you might be familiar, similar to diabetes test strip, except it has our own custom microfluidic channel. This is the test strip itself. So we're going to lay this down over here. And then I'm going to pull out a quick lancet, which is going to do the poking.
The poking?
Yes, the poking. So we're going to unwind this.
Okay.
And hopefully this works.
You said hopefully it works. Oh my goodness.
This is a live demo, you never know. So we're gonna
Oh,
prick your
brother.
finger right here. And did you feel that? No?
Slightly. No, it was lovely. It was.
It was
Oh my
a
goodness.
lovely experience. So that's a little bit of blood oozing out there, just not too much. So now we're gonna take this strip, and on the strip, there's a spot where you essentially put your drop, and it flows in. So we're gonna hold that against the strip right at the spot. Just gonna ease your hand there. And we're gonna press down on the strip. And within a few minutes, we should see that blood begin to flow in. I'll hold it up for the camera. And that blood is sort of starting to flow into the microchannel and basically take over the whole space. And what's happening right now is our custom stain is interfacing with the blood sample, and we're also generating what's known as a monolayer, or a single layer of blood cells, such that we can actually image the cells individually as opposed to seeing stacked features, which would force us to lose signal. And now what I'm gonna do is I'm gonna insert this strip into the device. I'm gonna pull up the mobile app on my phone. So this is the Athelas mobile app right here. And from there, we're going to pair the app to the internet, which is the tricky part. The deep learning, not so much.
Out of a question, what are you testing me of?
So currently, the one test we have rolled out in production right now is the white blood cell count. And this is the most definitive marker of your immune health. It's usually a count that ranges between 4K to 10K cells per microliter. Counts that are higher than 30K are traditionally classified and put down for testing for leukemia and are pretty concerning. Counts that are less than 4K traditionally mean that your immune system may be a little bit, essentially not working at expectation, and there may be something that needs to happen to correct that, like an immune boosting supplement, or in the case of chemotherapy patients, sort of a drawback in the aggressiveness of the chemo.
So, considering the fact you've just drawn blood for me, and I'm going to find out that I have a potential deadly disease, what's a good result?
So, well, a good result would ideally be between 4K to 10K. Your count can fluctuate more than that, which is why one of the things we've stressed is not being an end diagnostic, but rather a tool for doctors. So sort of like a metric, more like a temperature than a doctor that tells you if you're sick or not. And
okay.
So no need to stress if your count is a little high. Let's hope it's not. But
yeah, that would be lovely.
So we're just pairing to the Wi-Fi right now.
Okay, and just while you're pairing the Wi-Fi, and I'm
Sure.
hoping that I live in another day, talk me through this a little bit.
Sure. So this is the device that we've been working on. Essentially, there is an imaging module in here that's retrofitted to have high resolution, high contrast, so we can image our samples with the strongest differentiation and cellular features. Inside there is a bunch of microcontrollers that actuate the sample and allow us to scan the sample by taking hundreds of images per second. And from there, we can essentially begin to run our deep learning on it on the cloud. And that's essentially where, cool, so I think it did pair. So I'm gonna go ahead and hit start test now. And we're gonna hit continue. And we'll see if this thing fires up.
That would be nice.
It would.
Not that I'm nervous. I'm more like nervous out of personal reasons. Oh my goodness, there's always a first for me, doing things on stage.
So we'll give it a bit to fire up and the results show up on my phone. And yeah, so essentially what happens is that we'll have the imager be analyzing the sample, and there we go, I think it did fire up.
So it's vibrating. I feel some kind of a
There we
vibration
go.
here.
That's a big win. It didn't work just 2 minutes ago off stage. But essentially, what's happening right now is we have our backlight that's illuminating the sample, much like a microscopist would. And from there, we're actuating it, we're scanning it, we're generating as many images as we can, and using stabilization and autofocus. And from there, those images are being collected on board on our processor and being sent back off to our backend, where they're being run through GPUs, which are running inference and classifying, the features like I mentioned, and then returning the count so that we can analyze it.
And tell me, what's the vision behind this?
The long-term vision is microscopy is something that's been the bedrock of diagnostics for nearly centuries at this point. And it's not changed in one way or the other for a long, long time. There's someone that sits behind a microscope, looks at a sample, essentially analyzes what kinds of features there are. And in the last couple of years, we've seen massive acceleration in computing power, specifically in the line of deep learning and applying convnets to recognize features that in many cases even humans can't. And I think our core insight has been to apply these deep learning algorithms to analyze the cells in a way much like a pathologist would, but instead automating that entire process, bringing a pathologist into a box, bringing a pathologist into every home in the country, every home in the world. And what that can enable is this same platform, tests that we're rolling out in a few months, things like malaria, platelet counts, white blood cell differentials, red blood cell counts, the entire range of tests that are going to enable things that previously required a lab, previously required a person, and just eliminating that. And I think that sort of plays into a previous trend in the previously existing trend where automation has made things both easier and cheaper, and just brought it to places where it previously didn't exist.
It sounds like an old printer.
We're working on that.
I know from personal experience with this device that it takes a couple minutes to send the results down, and we're running behind schedule.
Okay, so why don't we pull up the results we ran on Daniel right before.
Yes.
Your count was 10K, and I'll let you know if it stayed the same. But right over here, you see the Ethel's count.
Wait, that's a good thing, isn't it?
That's a great thing. So you're in range and nothing to worry about.
Oh God.
And obviously, it's not an end diagnostic. We're a metricing tool more than anything else. But it is good news. It's in range.
That's good.
Congratulations
Hallelujah.
on good health.
Thank you so much. Thank you. Bye-bye.
Thank
Cheers.
you, Daniel, and thank you, Tanay.
Thank you so much. That's the demo we have for you guys today, and super excited we were able to share it with you.
And he'll be sticking around to answer questions.
Definitely.
So brilliant stuff. So next up, we have Oliver Armitage, who is a co-founder of a company called Cambridge Bioaugmentation Systems. Historically, it's been incredibly difficult to make prosthetics or bionics that actually link in with the body, and they are building an API for the body to make that easy. Oliver, take it away.
Thanks very much, Seth. Slides. So I'm Oliver, one of the co-founders of Cambridge Bioaugmentation Systems, and we're building an open standard hardware and software connection for the human nervous system. So when I was about 14, I broke my thumb, and while this wasn't a huge injury, it kind of did slow me down for a few months. And I spent the whole time with this notion that if my thumb had been robotic, I could have unscrewed it, put a new one on, and I would have been good to go. And I loved that idea. And while it wasn't exactly the same, it's something that never left me. And so that led to me co-founding this company about 2 years ago. Chronic medical conditions, things that are wrong with us that we live with for the entirety of our lives, are ripe for integration with technology as a solution. Those kind of conditions are small things that are wrong with you that you do a constant amount of care to improve. So if it's diabetes, you're going to test your blood sugar regularly and take an insulin injection in order to get over that. If it's something like an amputation, you're going to have to go back to your doctor every 6 months and get your leg adjusted. But all of those small amounts of automation and care are what your body's naturally doing to keep itself going anyway, and these are the times when it's broken down for some reason. This portion of the medical system is actually most of the medical system. The US healthcare spending is about 20 trillion annually, and 86% of that is on these constant conditions. The people that are going back to their doctor weekly, monthly, annually for the rest of their life. And the fact that these then have comorbidities when they have separate additional conditions which make their health even worse is just adding on top. And so the reason we've got to this position is because over the last 100 years, we've really got very good at changing the world around us. The way we interact with the technology outside our body has changed massively, but we have changed very little. And we haven't yet really got to the point where we can interact with the technology from inside ourselves. Starting to, but not quite. And the key to doing that is this, the human nervous system. It's the data standard of the body. If DNA is the hard drive, then the nervous system is the internet. It's the way data is communicated all around the body, and it's the key to allowing interaction between technology and ourselves on a fundamental level. If we want to control something innately, or if we want to allow a piece of technology to control a specific part of ourselves to solve a medical condition, we need to interact with that nervous system. So where do we do this? At the basic level, the limb is the edge of the nervous system. The data rate in the limb, the nerves, is similar to a dial-up connection. You're talking 0.5 megabyte per second in order to do motion and sensation of the limb moving around. And that lets you do all of the 26 degrees of freedom, which is characterized of a single arm motion, including the sensation of all of that. If you go slightly closer to the center, the organs are controlled by slightly larger nerves that are constantly changing their function to keep your internal state the same. So those are data transferring around a megabyte a second or a couple of megabytes a second. Something like your liver, the ethanol you had last night in that beer you drank, your liver was slightly upregulated to deal with that ethanol production. Your pancreas, also slightly modified, it was slightly upregulated in order to produce more insulin to deal with the blood sugar as a byproduct of that ethanol, and probably from the cakes we had at lunch as well. And then your heart, which actually has two nervous systems to keep it regulated, was also probably running slightly faster today because it's a bit warmer in here and you've got increased blood sugar. And all of that is a constant change that's being administered by your body's internal control system. The spine is the sort of central data highway of that. If you were to look at the spine perfectly, you'd see about 1 gigabyte of data flying past every second. And if you could read every single one of those messages, you'd be able to understand all of the control signals going all over your body, and you'd also be able to understand all the information going back to your brain. Now, if we want to let a piece of technology into that system, into that network, in order to take over control of an organ that's malfunctioning, then we need to have an I/O port for the body, specifically for the nervous system. And that would allow you to control those medical conditions. And so that's what we've done. So we've built an open standard for connecting with the human nervous system for engineers. So back in March, we showed, for the first time, a live server-connected two-way connection with the nervous system of a limb. What that was doing was allowing our engineers, our data scientists, and our clinicians back in Cambridge to constantly understand and interact with the data being recorded off of this experiment, which was in Minnesota. That meant that our clinician and our engineer realized before the care staff that were with the animal that this is being recorded from, that she'd woken up from anesthesia after surgery before the care staff that were with her. And while we do this, over that month where we were collecting that data and while we were interacting with the nervous system, we generated 10 times more nervous data than the largest publicly available data set in the world, and are out-generating every research group that's working in this kind of field. Over the next 6 months, we'll out-generate them by a factor of 100. So we did this using an implementation of our technology into a first product, and that first product is amputee and limb specific. For the amputee, this product goes into the end of their arm or the end of their limb and provides an open standard between their tissue and a bionic limb. And that would mean that any of you could hack together a bionic device for that patient, and you would have permanent interaction with their nervous system to allow them to control and feel back from it. And that's just a single implementation of that technology, and it then translates across other conditions. The first patients will be using this device next year, and when those 10 patients have this permanent interaction between their nervous system and a bionic device, we'll out-generate everyone in the world every day. So we're building a standardized way of connecting between the human nervous system and pieces of technology, and if you want to hack pieces of bionic devices, then we'd love to hear from you.
Come and sit down. So if you have any questions, you can go to the Slido and ask them. We have some coming in already. I'm going to start with my personal favorite question as an investor, which is, what is your biggest need right now?
I think for us, our biggest need is access to blood samples, specifically those that are rare in Western countries, such as malaria, tropical parasites. These are things that we can very quickly train our algorithms to perform well on, and then as a result, deploy these low-cost devices in any clinic in a rural area and start doing malaria tests. So malaria blood would be great.
So if anyone has any malaria blood in their backpack, please see Tanay after the talk.
I think we just want more people to work with this data and realize what you can do when you have a permanent interaction with the nervous system. A lot of big pharma companies are starting to work with this, but it's not restricted to them. When you make an open standard and an open API, any engineer in their garage can learn to build control systems with that, and you don't need to be GSK.
How do you think each of your innovations will affect the health insurance industries?
I think that specifically with what we're working on, it ties in quite well for the interests of the health insurance companies. And that's because what we're really working towards is preventative healthcare, where if you take a test frequently enough and you extract the right signal from it, obviously not looking at all the noise and sort of creating this alarmist set of false positives, but if you're really able to extract the signal that matters, then it can help predict diseases earlier, and as a result, reduce the burden of not just health insurance companies, but all payers in the healthcare system. And I think that's a growing problem, both in the States, where we work out of, but also globally.
I think we'll see a significant change in how health insurers pay for care of chronic treatment. They, at the moment, pay out constantly for drugs to treat chronic conditions. And those, A, they have bad side effects which grow over time. But B, it's just a very constant cost of care that never really goes away. When you fully connect people in, you manage to care for their conditions in a way where you're getting in front of those problems before a clinician needs to change their drug dosing. And so you'll see healthcare payers start to switch to a model where they're paying on a per service basis for a connected patient rather than for specific drugs.
Tanay, this one's for you. Why would a consumer buy an Athelis since they wouldn't want to test themselves every day?
That's a great question, and I think it's a very important one because what we're working towards isn't sort of at the beginning, at the very least, not a scenario where every single person in the world has an Athelis device, but rather the people for whom it matters the most. Specifically, people who have immune conditions, whether that's undergoing chemotherapy or chronic neutropenia. For these people, the counts that we generate actually do make an impact, if not on a day-to-day basis, at least on a weekly basis. And those numbers can mean the difference between spotting the onset of an infection early or spotting the risk for an infection early and getting the necessary care to help prevent that infection from sort of happening in the first place. And I think down the road, when we begin adding more tests, whether that's a couple months from now or a couple years from now, there's going to be enough tests where we see this shift from a lot of healthcare in general going from this sort of lab centralized doctor clinic infrastructure to more of a personalized infrastructure. And with that setup, it is possible that a lot of these tests do begin moving to the home, where you may have passive testing, not necessarily a prick, but maybe something where when you walk out of the door in the morning, you press your finger against some modern version of our device, and by the time you're in your car, you have a report, or your doctor has a report that highlights a lot of important issues.
Great. This is going to be the last question. Oliver, it's for you. Can your open standard NERD system interface work with the brain, and what would that mean for the future of remote bionics?
Of course. So this technology is as applicable to the brain as it is to the peripheral nervous system. The peripheral nervous system is just a much more addressable and safer market at the moment. You can build these technologies in the peripheral nervous system and care for huge numbers of chronic conditions and prove what you can then do with the brain later. Whether you're connected to the brain or to the peripheral nervous system, you can remotely control devices as much as you can control devices that are actually physically connected to you. Once I've got an open standard interface, if I can control a limb which is plugged onto me. I can also control a limb which is plugged onto a wall in the same room, or I can control a limb on the other side of the world. There's no spatial, and it can be a virtual limb as well. There's no spatial constraint in that. You can control anything you like, because the nerves are just the extension of the brain anyway.
I hope by seeing what it actually looks like in practice to combine profits with impact, you are all inspired to either start or join companies like that yourself. I know I'm inspired by you two every day. So a round of a hand for Tene and Oliver.